Hi, I'd like to talk about anal fissure. A fissure is where you have a break in the lining of your anal canal. It's when there's actually an ulceration over there. It's common, it's not dangerous, but it can be very painful. Usually it happens when we're constipated and when we're straining a lot, but it can also happen when we're having frequent diarrhea, for example. The diagnosis is with a physical examination. Your physician can, with a digital exam, it can be diagnosed. What's important here is that, is there anything else that's causing that fissure? Or is it not a fissure? Is there some other pathology that's associated with the fissure? For example, chronic inflammatory bowel disease, ulcerative colitis and Crohn's, for example. Or even more serious, more proximal lesions, like cancers, for example. Different autoimmune diseases, for example, can also present with a fissure. How do we treat it? Well, usually we treat the constipation, or rarely if it's from diarrhea, we treat that. There's also creams for it. And the principle behind the cream is this. It's the same medications as for the heart. It dilates, it opens the vasculature that's going into the fissure. In other words, providing more oxygen, and that's the way to treat it. Usually it takes several weeks of treatment with this cream. So now, if with diet and with medical treatment, this is not better, you may need a very simple surgical procedure that's done by our surgical colleagues. If we have 100 patients with anal fissures, maybe 1 or 2 will require surgery. But before surgery, for sure, you should have a colonoscopic examination to make sure that there's nothing else. And please remember that if we don't treat the reason why you've had your anal fissure, even if you have an operation, this can recur. Same thing with hemorrhoids, for example. If you don't treat the reason why you've had the hemorrhoids, even after an operation, they can recur. So anal fissure, it's not dangerous. Make sure there's nothing else. You may require a colonoscopy. If your symptoms persist, it may be a sign of something more important, more proximally in your colon. Thank you.